Hey guys, welcome back to the Pulling Curls podcast. Today we are talking about what every pregnant family needs to know about the NICU. So let's untangle it. Hi, I'm Hilary, a serial overcomplicator. I'm also a nurse, mom to three, and the curly head behind Pulling Curls and the Pregnancy Nurse. This podcast aims to help us stop overcomplicating things and remember how much easier it is to keep things simple. Let's smooth out those snarls with Pregnancy and Parenting Untangled, the Pulling Curls podcast.
This episode of the Pulling Curls podcast is sponsored by Laborie. At Laborie, we believe that great healthcare is an essential safeguard of human dignity. Our mission every day is to operate in a world-class specialist medical company, making and advancing technologies that preserve and restore human dignity. We do that by helping mothers and babies have safe deliveries in the OB and neonatal spaces. We are proud to have built our foundation in OB and expanded into the neonatal space in 2016. We look forward to growing this space, helping the hospital's smallest, most vulnerable patients. To learn more, visit www.laborie.com.
Today's guest is a neonatologist at Stanford University. She's a clinical associate professor of pediatrics. She is in the process with several companies working to design new products for neonatal and maternal health. I want to introduce today's guest, Dr. Janene Fuerch.
Hey, Janene, welcome to the Pulling Curls podcast.
Thanks so much. I'm thrilled to be here.
So I'm so excited to have a neonatologist on because I see so often on social media people who are just caught off guard by the fact that their baby has to go to the NICU. And sometimes babies go to the NICU, we'll share. Sometimes it's a longer stay. And so I'm just glad that you're here. And I'm glad that our listeners are here even thinking about this because I know it catches a lot of people off guard. So why do you think every family should know a little bit about the NICU?
Well, just first want to say, as a neonatologist, so I take care of sick and premature newborns all the time. It's never a place that we want any baby to have to go to. So it certainly is never the first choice. But if they do have to go, like you mentioned, it is quite jarring. It takes that perfect birth experience that everyone has in their minds and it flips it completely on their head. So maybe I could just paint a picture of what that could look like. And then I think you'll understand why you should know a little bit about it. So normally if you're giving birth vaginally or via C-section, however your doctor recommends, you have your partner in there and there's a limited number of people in the room. When your baby is having trouble, there is a lot more people that come in. So that more private birth experience becomes much more involved. And so we can have, anywhere from 2 people from the NICU, or we can have 15 people from the NICU. So it can get quite large quite quickly. And then there are times where every neonatologist and everybody in the NICU tries to allow you to bond with your baby or at least see your baby. But there are definitely times that we have to rush the baby back to the NICU for helping breathing, helping support their blood pressure, heart rate, etc. And that allows you to not be able to bond, not be able to hold, maybe never hear them cry, and sometimes not even be able to see them. So that's a really, really hard thing for parents. We usually at that time recommend that somebody decides who's going to go with the baby. So talking about it ahead of time with your partner or whoever's going to be in the delivery room with you. Are you okay with that person going with the baby if you have to be separated, or do you want them to stay with you? Because that can be a really nice way to start to think.
Yeah, I think that's really smart because maybe you want your mom to go with the baby and you want husband to stay with you. That's super smart. So I wanted to give people just like the basics. So 9 out of 10 babies are going to come out of the womb and be completely fine without us like doing much at all. Right. And then, so that one baby, 99% of babies are going to do fine with just the basics that we labor and delivery baby nurses do at delivery. So we might stimulate them a little bit. We might give them a little oxygen. And then on those, I don't want people to think this happens frequently, but it does happen.
Yeah.
And if anything, sometimes the nurse just needs to take the baby over to the warmer to get a better look at like what's going on. How's baby breathing? And I think even that a lot of people find traumatic because they're expecting this golden hour that everyone gets, right? When in reality, not everyone gets anything in the hospital. So I think it's so good that we're talking about this. Do you have any input on like how often are those statistics pretty close?
Yeah, I think that's really reasonable. About 10% of babies need help breathing. Now, the babies that I see tend to need it a lot more. And the reason for that is because I work at a high level NICU where we do a lot of planned deliveries, where moms who, have more complications during pregnancy and anticipated complications during delivery, as well as the babies have complications that we may already know about. So my numbers are a lot higher, but the ones that are most unsettling are the ones that you don't expect.
Yes. And that's the crazy thing, right? That's why as a labor and delivery nurse, when people say they're delivering at home, I'm like, cool, let's talk when the baby's out. Like, I want to hear your story because I love home birth stories. But sometimes that baby just comes out and it looked amazing my whole shift. And they're just like, no, not in the mood today. And you're like, oh, crap, I had no idea. So I think that's really important and part of why you want a NICU there. Some people might not know that we grade NICUs. So there's a level 1 that just kind of like the basics, right? They can kind of help stabilize the baby, but usually if the baby has pretty much anything wrong, they're going to a level 2 or a level 3 or a level 4. Is there a level 5 now?
There is not.
I
No.
keep waiting for them to add.
Sometimes in some states there's a 3A and B. So not all level 2s are the same. Certainly not all level 3s are the same. There's most variety and difference there. And then level 4 can do everything and anything, including ECMO, which is heart lung bypass for babies, which you really hope your child never needs. But we're here to provide it if it in fact does.
Yeah.
So level 1, you should know what kind of hospital you're delivering at. I think that that's something that's always surprising to families. So this is a really good point that you bring up about the different levels because they have different capabilities of actually taking care of your child. So if your child is born premature and needs help breathing through CPAP at a level 2, they can't stay there the whole time, which means then that the baby will be transported to a different hospital while you stay in the same hospital. And then you're separated for the duration of the time you're in the hospital, oftentimes, which is extremely hard because then you really can't even see your child. So I always recommend trying to consider delivering in a level 3 hospital if you can. And then a level 4 is always a good backup plan.
Of course, so many of you out there are like, well, the only hospital in my state is like a 2 or whatever. And that's okay too. You got to realize I've only worked at level 3 hospitals. So I work you work at Stanford, right, Janene?
I do. Yeah.
I worked down the hill in San Jose. So we would transfer babies to Stanford. But we were great at getting that baby ready to go. And if for some reason the baby needed to go, we moved you as soon as you were stable. We would discharge you so that you could go up and be with your baby. We totally understand that you don't want to be separated. And I know a lot of people want to deliver at a level 4, but like in Phoenix, I think we only have like 3 or 4 level 4s. So if everyone chose to go to those level 4s, you'd be in trouble because there isn't enough room for them. So I think a level 3 is an awesome, like, happy medium between the two. And also, I also find if you're looking for less medical births, those ones with level 4s tend to be a little bit more medical because they get all the problem children of labor and delivery. So those are a couple things to think about as well.
Yeah, absolutely agree. And I think delivering in a level 2 or a level 3 is absolutely perfectly fine, especially if your pregnancy has no complications, your baby has no known complications, and you've done appropriate screening. And I would encourage you to do that. Delivering at your local hospital is far better than traveling far away, delivering in the car, however, not making it. All of those things that we've certainly seen. I just think it's important to know that if your baby does need to go to the NICU, in the rare and off chance they do, you may be separated from them.
I think it's important to know that it could be an option. And at the same point, you might get separated from your baby. Like if you have some complication, your baby may need to go to the nursery while you are having something done for you as well. So I think it's important to know that stuff sometimes happens and we are always like looking to reunite the couplet, right? That is always our main goal. Even if you have to go to the main hospital, we're always looking to get you and the baby back together. So I think that's good to know.
Yeah, we do some pretty extreme things to get mom and baby back together because we know that that is a critical time. But I also want to say that, even if you are separated from your baby or your baby goes to the NICU, which makes pumping and milk production harder and is a really stressful time, there's not going to be any lifelong impact on your bond. You'll still be able to bond with your baby. It will be delayed and it won't be what you initially thought. And at times traumatic. Don't want to understate that. because there's a lot of people that have gone through a lot of trauma with their child being sick, as any of us would. However, you're still going to be able to bond. You're still going to be able to forge that relationship. So let all the guilt go away. Let all of the blame go away, because you'll get back to being together one way or
Yeah.
another.
And I got to say, as someone who's not a NICU nurse, but has spent a fair amount of time taking patients to the NICU or whatever in the NICU, those nurses love those babies just like their very own baby at home. Those nurses, they love the babies and they love the moms, and they really are there to keep everybody so safe. So I think people worry that maybe, they're rough with the babies or whatever. I don't know what you're worried about, but I am here to say those NICU nurses love your baby just like their very own. And I've seen them cry when those babies go home. Like, they form a real bond with your
Yeah.
baby as well. And it's nice to have all these professionals who are so willing to do stuff like that.
Well, we always say it literally takes a village. Sometimes your village starts right when they're born, and that's never a bad thing. It's a hard thing to adapt to as a mom, I would say, but it is. NICU nurses are the best, fiercest, most passionate nurses I've ever met in any field of medicine.
Yes. Do you have any quick tips for people if your baby were to go to the NICU? Mine is always, and it's not something that anybody wants to hear, because all my friends are like, well, I'm going to travel there in the middle of the night. And I'm like, girl, pump it home and get your rest. Like, this is your best babysitter you're ever going to have. And if you can get your rest while the baby's in the NICU, it's going to be so much better when that baby comes home. But it is hard, and no one wants to hear my advice. So do you have any good advice for people who end up in the NICU?
I do. And it's a lot of the same. One, be there when you can, but also don't worry about the times you're not. I love the NICUs, including ours, that have cameras at the bedside that they can see their babies at home. That actually really helps milk production too, to pump while you're looking at a video of your child, even if it's one you recorded, putting anything in their bed space that you're allowed to. Sometimes we have, little felt hearts that we do that then the baby can smell your scent, and then you can smell theirs when you're pumping, because that definitely helps milk production. But get the rest that you can while continuing to acknowledge that you just had a child and you need to recover too. I always say all my babies need healthy moms. So that's always the goal. Healthy mom, healthy baby. That's what we want, 100%. So I agree. Then when parents have had really long NICU stays, because sometimes, the babies have to stay in there for a very prolonged period of time. And usually you know about those ahead of time. But for those families, I say, please go on date night. You're not going to get more experienced, qualified medical professionals watching your child again. So go reconnect. Having that relationship is important, or take a break. I've definitely, quote unquote, kicked families out of the hospital and written them a prescription to go on date night. And so I think that's a big one.
Yeah,
too.
healthy families, so important. I love that. I've never even thought of it, probably because I didn't work in places where babies were in the NICU for so long, but that's awesome. Really smart. Okay, the good news is we have companies like Laborie who are here to help make babies' stays in the hospital better. I got to say, in labor and delivery, our technology has not changed very much until the products that Laborie has brought on the scene. And so it's really exciting. They have something that's called a life bubbles that can help babies stay in the NICU, be more comfortable and safer, and all those different kinds of things. So what types of technologies are we creating to make NICU stays better?
So there's a lot of technologies that are out there to make NICU stays better for the families. But overall, innovation in the NICU really hasn't changed much in the last 30 plus years. There really haven't been those innovations or the investment in innovation in this space. Now, being someone who does this all the time, I do see the tide starting to turn, and there's great opportunity, which, people can ask me about whenever they want to, because I think there's tremendous opportunity for innovation in the NICU. But not a lot is really being done. We tend to MacGyver, jerry-rig. There's a lot of tape involved. It is a bit horrifying when you look to see what we do for the most vulnerable patients that we take care of versus adults who we make big investments in as a society, as well as major med tech companies. So, full disclosure, I helped develop a Novonate and Life Bubble, but that is something that is specifically designed for neonates that helps secure their umbilical catheters. So umbilical catheters are actual IVs that you put in through their umbilical vessels They're painless, they're really quick, they're easy lines to put in. And you can actually give blood products, you can give fluids, you can sample blood from them without ever having to poke the baby, which is a really important thing. But the problem is they're right next to the diaper and they move, 30 to 60% of the time. So as those lines move in and out, they can take bacteria in and out, and they're right next to the diaper. So you can imagine how easy that is for transfer of bacteria. So they developed this really cool silicone protection that allows the lines to stay secure, see the numbers on the lines, while also allowing them to protect the actual umbilical site with the desiccating, or the stump actually decreases over time. And then those lines are less likely to develop an infection and less likely to move. So that is one of those innovations that's specifically for the NICU population, rather than the other quote unquote innovations that we see, which are often just taking adult devices and making them smaller, which is necessarily right for our population in every circumstance.
Right. And before this, we were kind of like taking a shoelace before, right? Or lots of tape, loads of tape. I guess the shoelace is how we would insert it. I never, labor nurse here, but, it was like a lot, like,
I know what you're saying. So we do like something, it's a
Yeah.
string, but it looks sort of like shoelace you tie around the cord to get it from spurting blood everywhere. Yeah. Yes, we do that. That's also special. And then the rest, I call it an art project. And, our nurses are far more qualified to do things as opposed to art projects, which is just like mangling tape together and sticking it on catheters and sticking it to the baby. It is shocking that we allow that level of imprecision in these patients, but it's something we got used to. But with Life Level, you can actually hold your baby, which I think that's the best part, because when these lines are, people are worried about them moving around. So the reason that we developed this too is so that parents could hold and feel secure that those lines weren't going to move or come out, or the baby was going to bleed. So I think that those are the kinds of innovations we need to see in the NICU, things that are smart, that are specifically designed, that really address a really impactful problem that affects the baby, the staff, and of course, the parents and their experience.
And you definitely brought up one of the hard things in the NICU is that your baby is going to have lots of wires attached to them that are monitoring oxygen and all these different IV things. And then we really want you to be able to hold them. But at the same point, you're worried that all the wires, you're going to mess it up, right? And so a lot of the innovation is helping parents still bond with that baby while still keeping everybody safe. Because I know parents still want that baby to be safe and monitored and all those different kinds of things. And I think it's so important that if you have a question, if your baby ends up going to the NICU and you have a question, you're worried about anything, don't be afraid to bring it up. Tell the NICU nurse, I really want to hold my baby, but I'm so worried about these wires. Don't be afraid that the nurse is going to think you're a bad mom or something like that for this. Tell us what you're worried about, and we can help you. Because again, nurses are the kings and queens of MacGyver. We want to make things work for you, even if there isn't something amazing like Life Bubble.
Yeah, and I hope someday we don't have to MacGyver as much, but it's a big deal for you to hold your baby and do skin to skin. We know that skin to skin contact, whether it's you or dad or another loved one, does a lot for the baby. One, it helps them temperature regulate, which is super important to going home. It really helps them stay calm and their vital signs calm down when they're on you, usually, because that's where they're used to being. And they feel very comforted by that. And then it also helps with neurodevelopment. So it helps their brain develop, which is a crazy thing to think that it could have that level of impact, but it does. So we need to do everything to make that possible. But parents are always scared, and they're always reticent to say that they're scared. So I make a really big deal about, you're holding your baby today. Gonna be okay. We're gonna do it. So definitely encourage you to bring that up if you're in a NICU and that's not happening, to ask why and be there frequently to hold your baby.
Yeah. And I think some parents feel like they're being selfish by I like how you mentioned like all the benefits, because the parents think, oh, skin to skin is just for me to love this baby. But there are so many benefits to you. I agree, but also so many for the baby. to have you close there. And I love that we're working to make that better.
Yeah, that's a good point. It is definitely not selfish. It helps you get more milk. Like that's what your doctors want. That's what your baby wants. That's what your nurse wants. That's what your respiratory therapist wants. Even if it's hard to do because of all the wires and tubes and things, we still want that. And every day if possible. And if not, then that's okay too. We'll work around
Yeah.
that.
And, coming every day and trying to time your visits. So there's, just ask questions of the nurses. What would be the best time for me to come? So you're not coming at a time where they're, performing something that they know they have a chest x-ray at a certain time or whatever. Just ask questions. Those nurses really want to support you, but sometimes they don't like deluge you with all the answers until you ask.
Yeah, definitely.
So I think that the life bubble is so helpful. What other things are you seeing coming to help these babies stay better at the NICU?
Yeah, to be totally self-serving, there's some really interesting stuff that my team is working on that I think is really fascinating. And frankly, I don't see a lot of other really innovative products. Otherwise, I would talk about those too. But one thing we're working on is diagnosing a condition called necrotizing enterocolitis. It is a gut infection that affects premature babies or those with cardiac disease and can actually cause their gut to rupture and bleed and the gut actually die. So it's a really severe infection that can cause a lot of, we call it morbidity, so injury down the line or mortality or death in neonates. They're about 20%. But the problem is that we can't diagnose it in a good way. So if you're in the NICU and you have a premature baby, you will hear us talk about this every single day and worry about it every single day and look at your baby's belly every single day. So we actually my team developed this continuous breath monitoring sensor and system that allows you to be able to potentially diagnose this earlier. So it's the only thing out there that's being researched that could diagnose it from a breath-based sensor. So I think that's really exciting because I really, really, really hate this disease and it stresses me out and I worry about it every single day. And the parents worry about it all the time. And it is absolutely devastating when it happens. So that one's really cool. But probably the most game-changing innovation out there, and full disclosure, again, I work with a lot of neonatal companies, but this one I am their neonatal advisor and consultant, is a company called Vitara. And what they're doing is creating an artificial womb therapy for premature babies born too early. So between 22 and 24 weeks gestational age, which is actually only halfway through gestation. And they're creating this fluid-like environment that you deliver the baby, prevent them from taking their first breath, which allows them to stay in more of a fetal state, submerge them in a fluid environment, and actually put the catheters into their umbilical vessels, like we talked about before, and then keep them in the system for up to 4 weeks. This is not FDA approved. This is not, there yet, but it's really exciting because there's not a lot of great outcomes and there's a huge mortality in these really premature babies. So this is the first thing I'm seeing that could really move the needle in potentially decreasing their rates of injury and death.
Oh, wow.
So those I think are really,
that's
but those are at different extremes, right?
That'll be for my grandbabies, maybe.
The science has been around for a while, but Dr. Alan Flake and Dr. Marcus Stevie out of CHOP Children's Hospital of Philadelphia are the ones that have done a ton of animal work in this space. And then the company is bringing it forward.
Wow.
So hopefully before your grandbaby's grandbabies.
Hey, you never know. That's amazing. And I think you guys need to understand that when you look at the rest of the hospital, especially in the OR, like from when I was in nursing school till now, the advances are insane, right? Like there have been so many big changes. But from when Hilary started in labor and delivery in 2001 until now, things have not changed a lot. And so we have to have companies like Laborie and like other companies that are willing to jump into this space that could be, we are so litigious in mothers and babies. But we have to have these advancements in technology. So I'm really grateful for companies that are willing to jump in and give it a try.
Well, I think that it's critically important as a society that we continue to invest in these children. I mean, we spend more money in the last month of life for healthcare than we do for these children if we invested more could literally transform their lifetime. And I just want that to sit with people because that's where our priorities are. And, anybody who knows me says, well, kids don't vote. And this is part of the reason why, but there aren't great incentives for companies to get into this space. Albeit, I think there is a real ROI, so return on investment here, that people need to start paying attention to because no one cares more about their children than parents, and they are the best advocates. Part of the reason I love being in neonatology is the amazing parents we get to work with and being there in a really difficult part of their life and trying to make that a little bit easier.
Yeah. Janene, thank you so much for coming on, and thank you for the good work that you do. Neonatologists are almost always one of my favorite doctors in the hospital because they really love the dyad, they love the parents, and they love the babies. And I think that's such a great, so glad for great neonatologists out there.
Well, thanks. It's absolutely our pleasure, and we love what we do.
I hope you guys enjoyed that episode, and I hope you understand why every pregnant family needs to know a little bit about the NICU. It's just one of those interventions that might end up happening, like an induction or a C-section. So it's just important that you understand them, how to get the most out of your stay, and how to manage your life around the NICU. I'm so glad you guys are here. Stay tuned for our next episode where we're talking about unplanned pregnancies. Stay tuned. Thanks for joining us on the Pulling Curls podcast today. If you liked today's episode, please consider reviewing, sharing, subscribing. It really helps our podcast grow. Thank you.